I'm David C. Peterson, MD, Anchorage Fractional Orthopedic Clinic spinal surgeon. I deal with adult degenerative conditions, and today I'll be talking about spinal stenosis, its treatment and evaluation, and expectations for patients. Spinal stenosis is a degenerative condition that is the result of progressive narrowing of the spinal canal from osteophytes or bone spurs. It can occur from the vertebral bodies or from the facets, and it results in compression of the spinal cord at the neck or thoracic level and the nerve roots or rootlets at the lumbar level. Typically, patients can have not only axial pain to the neck, thoracic area, or the back, but they will get often radiating arm pain or leg pain, numbness, weakness, and in the case of the spinal cord compression, we'll get what's referred to as a myelopathy that results in potentially unsteadiness of gait, spasticity, and difficulty with fine motor activities or coordination. As mentioned previously, spinal stenosis symptoms vary depending upon the location in the spine. If it's cervical spinal stenosis, where there's cord compression, typically patients may experience paresthesias or tingling in the hands. They may have weakness or fine motor difficulties with small objects or handwriting. They may also experience problems with gait, coordination, balance, and even bowel and bladder difficulties or control issues. In the lumbar spine, more typically, patients develop radiating leg pain, numbness, weakness, especially with walking and standing, which is referred to as neurogenic claudication, and often can progress to weakness, numbness, and even bowel or bladder issues. Spinal stenosis is diagnosed through a combination of clinical evaluation and radiographic imaging. The clinical exam will involve reflex testing, motor testing, sensory testing, and tests also for balance, coordination, etc. Once the suspicion for spinal stenosis is present, imaging studies including MRI, plain x-rays to check for stability, and even sometimes CT myelogram studies for a more dynamic assessment of nerve root compression is indicated. Also, occasionally we'll use electrodiagnostic studies such as EMG or electromyograms and nerve conduction studies to rule in or rule out other diagnoses. In the early phases of spinal stenosis, treatment can consist of physical therapy, occasionally injections such as epidural steroids, and oral medications including non-steroidal anti-inflammatories, or in severe acute cases, sometimes even an oral steroid is indicated. In more advanced cases, typically surgery is required, and depending upon the extent of the pathology, the area involved, it may require decompressive surgery such as a laminectomy over one or multiple levels, possibly even anterior procedures such as corpectomy or removal of portions of the vertebral bodies to obtain adequate decompression of the spinal canal. Occasionally this is accompanied by a stabilization surgery which involves bone grafting, instrumentation to prevent any malalignment or instability of the spine as well. The postoperative course for most patients with lumbar spinal stenosis is generally fairly favorable. Usually the leg symptoms will improve almost immediately, some dramatically. Others, if they have deterioration of the nerves prior to surgery, may have chronic radiculopathy, and their recovery is generally more gradual. They may see improvement in the nerve function out to 3 years, but if the nerve injury is severe, there may be permanent changes in the nerves that may not recover. But usually pain associated with spinal stenosis in the lumbar spine does improve gradually as the wounds heal. In the cervical spine, again, the prognosis is dependent upon the severity of the pathology. Individuals who have severe cord compression and myelopathy will often have unsteadiness of gait and hand coordination problems, which may persist after surgery. Cervical spondylotic myelopathy often is more severe when diagnosed. It may be progressive over a longer period of time, and it's less reversible. Therefore, the surgery that's done for cervical stenosis is often done at an earlier stage to prevent disorders or prevent difficulties that will not resolve. To learn more about spinal stenosis, its diagnosis and treatment, please visit our website at afoc.com.